Tuesday, April 7th. Clerk, will you please call the roll?
Bajent.
Here.
Clegg.
Here.
Halliburton.
Here.
Sanchez.
Here.
Thompson.
Here.
Woodings.
Here.
All present.
Madam Mayor,
Yes.
I'd like to make a motion that we defer item 4A, public hearing request for CAR 19-26 and ZOA 19-07 to further notification.
Second.
I'm sorry, I'm just looking at my agenda. Just so I make sure I don't do it again, we have a motion and a second. You said 4A, but do you mean?
I meant 6A, I'm sorry. I read my Roman numeral backwards.
6A. Oh, that public hearing request. Okay, great. Thank you. Clerk, will you please call the roll?
Halliburton.
Yes.
Sanchez.
Yes.
Thompson.
Yes.
Woodings.
Yes.
Bajent.
Yes.
Clegg.
Yes.
All in favor, motion carries.
Thank you. And now we will move on to a request for approval of the minutes from March 31st.
Madam Mayor, I move that we approve the minutes from March 31st regular meeting.
Second.
We have a motion and a second. Clerk, will you please call the roll?
Halliburton.
Yes.
Sanchez.
Yes.
Thompson.
Yes.
Woodings.
Yes.
Bajent.
Yes.
Clegg.
Yes.
All in favor, motion carries.
Thank you. And now we will move on to item 5, special business, our weekly update.
This is Mallory. I'm guessing that's me now then. Madam Mayor, members of the council, good evening. Another week has gone by and we are still unfortunately dealing with the effects of the COVID-19. My screen share. So then you should all be able to see that's my presentation screen. Is that correct? Okay.
Yes.
Good. So per usual, starting with a little bit of the case updates as of today. Across the US, we are up to about 375,000 total cases and 12,000 deaths locally here. Just a couple minutes ago, I checked the state website and there are 1,210 confirmed cases in the state with 15 deaths and 438 within Ada County and 3 deaths. And just for some perspective, both of those numbers have a little more than doubled since last week's update. And then within the state, they have conducted getting close to 12,000 tests total between the state lab and the commercial labs that are also doing that testing. And so with that, a couple of graphs that I put together just to do some illustration to see kind of where we are. Last week, this is the graph that I showed kind of our trend lines of cases within the state and the county. And then on the, what I'm assuming is your right-hand side as well, is the to date where we are. So you can kind of see, we're starting to see a little bit of a curve with that. So that's kind of where we are. Thankfully, our death line there at the bottom, our fatalities, is still significantly low, which I think is a great sign. So that's just a little bit of comparison to see where we've come in the last week across the state and the county. And then I added this one in this week, which is the new cases that we've seen since we first saw our first case back on Friday the 13th last month. So we are seeing a bit of a downtrend in new cases, but this is, it's still been a rather short time frame. So I will say that there's still the potential for increases in new cases as we go forward, but just wanted to show you guys this data of where we are versus where we've been since that first case.
Madam Mayor? Mallory, could I ask a question about that? Do we
Sure.
know how much of the flattening of the curve is in Ada and Blaine versus the rest of the state? In other words, is the rest of the state flattening also, or is it regionally?
Well, and that's kind of why these graphs, so the top line in both of these is the state trend, and the kind of the middle line is our county. So I haven't put any other counties in there, but this is just how Ada compares to the rest of the state as far as those curves go.
I guess my question is, while I think we've taken some pretty strong measures, and Blaine has had some pretty strong measures in force for a while, much of the rest of the state wasn't until the stay-at-home order. And I just was curious if they were still trending up at a higher rate than we are.
And a little bit of my unofficial and informal analysis, there's still, the state as a whole is still increasing slightly more rapidly than we are here. Yeah, you can kind of see that our curve is a little flatter than the state's is still.
Right.
So yeah, it does look like the state as a whole is still increasing a bit more rapidly than we are here in Ada County.
Thank you.
And again, the trends kind of show a similar thing. You can see our Ada County cases kind of as a percentage of where we compare to the rest of the state in this. So then moving on to the resource center. So that continues to be staffed 7 days a week for 8 to 5. Just to note that this Sunday, I think they're going to reduce the staffing for a little bit due to it being Easter. But as a whole, since we enacted this resource center, 320 emails and 530 some odd calls. And so we really have seen the volume level off this past week. And it looks like emails they're still majority COVID related, but a lot of the calls seem to be less COVID related and kind of a lot of general city questions still. But that's still staffing. We're still staffing that, and so we can still answer the questions through that. Moving on to city operations, we continue to kind of look out a little longer based on the fact that we're probably going to be in this for a little bit, and looking at reevaluating those essential services and delivery of those services for a longer term duration to make sure that we're not missing anything, and that given that if we had some potential reductions in staff, that we can still deliver those services. So departments have been looking at where it's potential to cross-train employees within the departments to fulfill those services, and then also where other departments could be of assistance, or where they could be of assistance to other departments to kind of cross-train and fill across departments where possible. And then I think, as we mentioned last week, or at least somewhere in some of the sit reps this week, there's a kind of a financial working group step that's going to be working to exploring all the various reimbursement and stimulus money options that are going to be out there to evaluate which ones are going to be the best for the city to pursue. So that's ongoing. This week, the CDC put out that new guidance asking that everyone wear masks, cloth masks out in public. And so it's being evaluated across all the departments what that impact is, and being able to source those for employees. And then, of course, and we'll get into this kind of at the end, Kyle Patterson's going to walk us through some kind of emerging best practices as far as some considerations for that longer term planning and recovery as you look at policies and things like that. So we'll get to that last bullet kind of at the end. So focusing, excuse me, on some of the big focus areas in the community needs of vulnerable populations. The community isolation bed plan is still ongoing. still holding steady at that stage 1. I believe you guys all were able to see that in Friday memo last week. So still kind of holding steady on that planning, and then continuing to communicate to the various community partner groups, multiple languages, businesses, nonprofit, faith communities. They are getting emails once a week with updates. And then a new initiative is exploring some food stability options. So looking at where folks might have had disruptions to how they get food, and where we can be of assistance in connecting those folks to their needs, and specifically with food. And I will say a couple of these efforts are also being coordinated kind of up to the county and that by county level as well, so that the resources that are out there are available. The county and the state, everywhere, pushing everyone to 211 as a place to be able to solicit where you can find resources. So we're pushing what we have up to them so that they'll have that if people ask where they can find stuff in Boise. And so really going to bolster that effort. And then a couple of high points for the week as far as this effort goes. And Christine is available if there are any questions on this, on any of this vulnerable populations and community partnerships effort. There has been, I'm sure I've seen it in the news and kind of, across the internet, that this 3D printer leveraging those resources to print various items of PPE, sharing those templates for some of those homemade cloth masks that we've seen go around, redeploying volunteers to other needs, and then again, referring those individuals effectively across the community. I think that's working well with our efforts in coordination with some of the stuff that's happening up at the county level. And then internally, a lot of this work, there's been a lot of employees from various departments that have been working on these efforts with some quick problem solving and solution and really great innovation. And so it's been really great to see folks from various departments come together to work to find solutions to some of these community problems that we've been seeing.
Madam Mayor, it's Lisa.
Yeah, sorry, go ahead.
Mallory, thank you so much for this information. Can you give us some examples that you're referring to about individuals doing some of this work?
And I will ask if Christine is on she could really highlight the more specific examples much better than I could. And I know that she had logged on.
Madam Mayor, Councilmember Sanchez, were you looking specifically at that referring of individuals across? That was the one. Okay. Yeah, I think that comes back a little bit to what Mallory was talking about I would say in the past, we've kind of struggled if someone contacted the city or the county, but they were at the wrong spot. We had a harder time getting them to the right spot. And it seems like never waste a crisis. In this new world, we've just been much more in sync with our partners in the community from different, nonprofit organizations or across city, county, state agencies. And it seems like we're just getting in much better alignment and are able to make better referrals. As Mallory referenced, kind of that 211 hotline for the state. We're now sharing information so that if somebody inbounds there, they can quickly pass them to the city if it's a city referral or vice versa. So I think we're starting to get a little more nimble than I had seen us be in the past.
Thank you, Christine. Madam Mayor, I have a follow-up question.
Sure.
Something that I'd like to ask about, and I guess I'm not really sure how to approach it, so I'm just gonna, as Mayor McLean says, just use people talk. But one area of concern that we have in terms of vulnerable populations is our folks who are not documented, and how being undocumented in this crisis may affect their pursuit of treatment if they feel that they have COVID-19, or any other type of help. You know, right now we're hearing that there is a spike in domestic violence issues because of folks having to be in close quarters. So I just want to put that out there that I don't know if we have done anything to reassure our undocumented population of what they can do in this crisis if they feel that they do have symptoms and that they need to get tested or seek treatment. So that is a concern that's been conveyed to me. Apparently, there are some states where they use a texting technology to not only remind folks that they need to stay home, but also to communicate to those vulnerable populations, the folks who are undocumented, that that there is a suspension of, I believe it's called the public charge, and that is to make sure that folks are being tested, that they are seeking treatment, so as not to prevent them from seeking those services. So just wanted to make sure that that's something we were keeping an eye on as well.
And I've made a note of that as well.
Thank you, Mallory.
And so I think that's kind of the end of my little update for the week. I wanted to devote a little bit more time to have Kyle Patterson present on some new best practices from Harvard, kind of an adaptive response. So what it is going to start to look like going forward, some considerations that we can take as a city as we look towards hopefully recovery sometime soon. And so I will turn it over to, unless there's any other questions for myself or Jade regarding kind of city operations and the COVID response thus far. If not, I will turn it over to Kyle.
Madam Mayor. Thanks so much, Mallory. I know that we've seen some updates about kind of sending some of our police officers or bike patrol over to working with some of our homeless organizations a little bit more. I am getting a lot of questions about who's monitoring parks and as far as behavior at parks and trailheads. And I don't know if there was an update that I could pass on to people about what type of enforcement monitoring. I know that we had brought up an ambassador program pretty early on is going on at some of our larger parks like Camel's Back, Julie Davis, and Morrison. That's kind of where I'm getting most of the concerns from the community at this point.
Madam Mayor, council member, this is Jade. I can address that. What we've agreed first is between parks and then what's called our compliance team that works under finance administration, who does code enforcement, animal control, so forth and so on. They've been redeployed to be kind of the first line of monitoring along trailheads and the parks and that type of piece, and just trying to be friendly ambassadors of social distancing and those type of things. Again, just leaning on people to have their best day. We've also updated some monitoring and counting equipment at some of the trailheads in the parks so that we can just have better data as far as just monitoring how we're doing on counts and that type of piece. Should things progress, beyond that, then police would partner with DFA's compliance team, but we're kind of just doing it in a phased manner. So they will, really knowing the next couple of days is going to be really nice weather. We are anticipating maybe some increased challenges. So that team will be out and going tomorrow.
Thank you, appreciate that.
And I'd like to reiterate for the public that there have been calls to 911. We do not want you to call 911. If you feel the need to call regarding enforcement, please use a non-emergency number so that the emergency number is open for true emergencies.
Madam Mayor. Just another update. I had a couple of constituents contact me today, so I asked the question, and Parks told me that they really are going to step up tomorrow, and they have a phase plan, as Jade referred to, about taking the next step tomorrow, and if things are not working out, they have some other ideas in mind. So made me feel better that some of the issues that people are seeing, we are going to be responding to.
And the other thing, Madam Mayor and council members, we did also close all tennis courts, pickleball courts, and basketball courts as of yesterday. That was kind of just as a best practice that we were seeing of other cities as well. So that's been implemented. So you might hear more about that from constituents as well. All right, over to you, Kyle.
Madam Mayor and council members, good evening. This is Kyle Patterson. I give it about a 10% chance that my 4-year-old daughter comes barging into my room at some point. So apologies in advance if that happens.
Just don't do this.
Let me share my screen here. I'm hoping everybody can see that. So let me start by saying I am not an infectious disease expert or a public health authority. But I have been doing what I can to monitor what kind of research and what the experts across the country are saying about what the recovery phase of the pandemic might look like and best practices related to that recovery. So I'm going to share with you a few slides from a recent webinar put on by Harvard University and Johns Hopkins. Specifically, the slides, excuse me, come from Dr. Tom Frieden, who is an infectious disease expert and is the former director of the CDC. And I think the key takeaway here is that we shouldn't expect there to be some sudden recovery in which we get past a surge period of cases and then life goes immediately back to normal. We should really be prepared for a slower recovery and make sure we're adaptable in our response. So the first slide shows what a recovery might look like. I want to make very clear that this is not a forecast. I'm not saying that this is what Boise's experience will be. It's just for illustrative purposes. But the curve really represents the number of new cases over time. So we see an initial surge or spike in cases followed by a decline. I think we've all become used to seeing this curve and the conversation about trying to flatten that curve. But what this really shows is that it likely won't end there. There's an expectation that there will be future outbreaks in which we see a spike in cases and need to contain the virus quickly. And in fact, the better we do at flattening this initial curve, the sooner we might expect to see a subsequent outbreak. Case in point, this slide shows how 2 different cities responded to the 1918 influenza pandemic. So the chart shows the death rate for 2 different cities over time. So a higher point on the curve means more deaths. Philadelphia, which is the solid line, responded very slowly to the outbreak. In fact, I think they allowed a massive parade to occur a couple days after the outbreak began. And you can see that they really didn't flatten that curve and they saw a really high death rate. On the other hand, St. Louis, which is that dashed line, quickly acted. They closed schools, they closed churches, they closed theaters, and they saw a much smaller peak and a far fewer number of deaths after that occurred. But then you do see once they started to lift restrictions, they saw kind of another outbreak. And so that might be something that we need to prepare for. So Dr. Frieden also talks about and makes a point that it's not just about when we lift restrictions around healthy distancing practices, but it's about how. And he uses the metaphor of slowly opening a faucet. So we might slowly open the faucet by lifting some restrictions, restarting some city services, and then wait to see what happens. If we do see another outbreak, we might close that faucet again. If we don't, we might open it even more and wait to see again. And so he really talks about the when and the how. So when it's safe to come out again. And I think the short story here is that we can end healthy distancing when we feel like we have the resources and the capacity needed to quickly contain a new outbreak. So 3 things to consider on when it's safe to come out again. One is when cases aren't spreading quickly. So the number of new cases is very small or 0. And you saw Mallory's slide showing that number of new cases. Second, when hospitals have the capacity, if there's a spike to occur, and that they also have their health staff have PPE so that those health staff are safe. And the third piece is around public health capacity. So that system has to be able to do very quick contact tracing and quarantine and isolate folks quickly before the disease spreads further. And then on the how side, how to safely loosen that faucet. I think the key here is that it needs to be slow and thoughtful. So first, we want to make sure that we're protecting vulnerable populations. And so we want to protect those folks. We want to reopen services in kind of a phased fashion. So starting with the most important, most essential, lowest risk services. And then we need to be prepared at any time to kind of close that faucet again if we see a spike in cases. So to make this real from a kind of a city services perspective, facilities maintenance is something that we haven't been typically considering an essential service so far. So staff might check in on facilities occasionally to make sure there's no vandalism, no pipe bursts, anything like that. And they might do emergency repairs, but that's all. But obviously there's only so long you can defer maintenance. So we might, in a first phase of opening the faucet and reconstituting services, we could restart facilities maintenance, keeping in mind that those folks are not very likely to spread the disease because they can do that work while maintaining social distancing. But we might have exceptions in place for medically vulnerable staff. We might also check their temperatures twice a day as a precautionary measure as well. So that's just a quick overview of some of the work that I've seen being done, and I'm happy to answer any questions you all have.
Madam Mayor,
Go ahead.
Lisa. Kyle, thank you for that. I know a lot of folks who had events planned for basically now have moved a lot of them to the fall. Based on this research that you've done, does that seem prudent, or is that something that folks should consider maybe waiting even longer to put on their events like Tree Fort and such?
Thank you for that, Council Member. I don't want to overreach here because I think there's a lot of uncertainty there. I've seen a number of different models and forecasts around when we might see that peak and that surge, and they range from in the next 7 to 10 days to 3 months out. I am hopeful. I know that there's a group of academics from different Idaho universities who are working with the state right now to come up with a model and a forecast for what that kind of first peak or surge might look like for us. And I'm hopeful that will come out in the next week or so, and that should provide more information. But I would just say that it's really important that our response is adaptive. So I think the disease is going to decide when it's done, not us, and we just have to be prepared for what that is. So sorry if it sounds like a non-answer, but I think there's just a lot of uncertainty involved right now. So I think we're all hoping by the fall, but nobody really knows.
And Madam Mayor, Councilor Sanchez, this is Jade. One of the other things, aside from where the disease will be and what the community will be experiencing, we are working through the fact that it's just gonna, with everybody pushing their events to essentially September and October, we're just gonna have to work through some prioritization because the cup runneth over on the number of events. So even if we're in a good stage from a community health perspective, I think we're gonna have to just work through kind of making sure everybody's balanced as far as the number of public events.
Madam Mayor, just to follow up to that, Jade, are those conversations happening now in terms of talking to folks?
Madam Mayor, Councilor Sanchez, absolutely. And we're also, yes, we're talking about the ones that have been deferred to the fall. We're also talking about those who have events from June and July that maybe haven't rescheduled yet. Encourage them to be thinking about what is their backup plan so that we're not having any kind of crisis moments in the event that this rolls through the summer.
Thank you.
Madam Mayor, I guess I'll follow up to that if I could. So the question is, are we going to, and Kyle, this kind of goes to your slides here, as we slowly loosen that faucet. As we tightened the faucet, we had to do it pretty quickly, but there were still a couple of steps, very large groups, smaller groups, and then down to 10 or more. Will we go back the other way in the same manner? So in other words, we might decide it's okay to have a group of 25 or 50, but we don't want a gathering of 250.
Mayor, would you like me to respond to that?
Yeah,
if you could,
Yeah.
whoever can.
Yes,
And you may not know the answer, but I'm just posing it.
Yeah, great question, council member. I think you're right. I think what we need to do is stack up what those different restrictions are that we have in place and then start to have a conversation about what that sequencing might look like. So if we get to threshold A where we're not seeing any new cases and we feel like we have the capacity in the public health system and the hospital system, and we want to loosen that faucet, we might start with, the kind of highest level restriction, let that off and see what happens. But I don't think we've made that decision about specifically what that first step lifting would be.
Thank you. And then a second question, if I could. I know we've been working really closely with the public health agencies. And if you go back a slide, I think one of the things that we need to be prepared for is how to both test and trace patients and contacts as quickly as possible. Do we foresee a continued role for the city in that? And do we know yet what that might look like and what, if anything, we can do to help strengthen that system?
I would defer that question to Jade or the mayor. I'm not sure if I have a good answer to that question.
I'll jump in here. I don't have a perfect answer either. I mean, we need more testing and we need tracing to happen faster than it's happening if we want to be sure to stop spread. And ultimately, as we can see by this chart, if we want to have the data in place, the information in place to keep people safe when they go back to work, or for us to decide, which groups can exist together. Right now, I think I probably mentioned last week, city staff is doing the tracing for any city staff that have positive tests because the health district is over capacity. And then if you look at the number of tests that have been done by the health district, you can see that it's not nearly enough. And so we will have a capacity issue, not only related to testing, which we don't have enough testing now in the city, county, or state, but also in relation to the capacity to trace. And today a group at Salzer launched, I think it's crushthecurveidaho.com, and they have found capacity to increase testing, working with the VA and some private test companies in Utah. They've secured the swabs and then the capacity to test. But they're still saying, I believe that then the tracing goes to the health district. So that trace piece also is something that if we could come up with in a HIPAA compliant way, a way to redeploy some of our folks to make phone calls and do tracing, I think it's something we ought to volunteer, because we got to think creatively about how we meet the needs right now. But there have been times when I've asked the question, and often it's some of these HIPAA issues, yet our city staff is tracing the contacts that our city staff have made. So there's got to be a solution in there somewhere.
And Council President Clegg, I'd add that I think this slide really speaks to the importance of that coordination and communication across these different organizations. Obviously, this isn't a decision we can make ourselves. We have to be in close contact with hospitals and public health departments to make sure that they have the capacity that they need.
Yeah. Thank you. I appreciate that answer. And I guess I asked that question because if there's, as we get to the budget decisions and some of these things, if that's something that's going to help us deal with that, figuring out a way to trace, and it has about budgeting implication, I'd like at least to have the opportunity to consider it.
Madam Mayor, this is Jimmy.
Go ahead, Councilman Halliburton.
Hey, Kyle, I really appreciate the presentation that you've got here, and I was able to sit in on a call from Harvard earlier in this week as well. Do you know if this is something that you think the CDC or our Central District Health or public health organizations here in Idaho are considering as far as their plan? And I asked that question just thinking that if Boise, who has looked at this issue kind of as Council President Clegg brought up, as doing these steps one after another, we also did those steps, before the state and before our surrounding communities had done that. And so I guess what I'm asking is, like, do we anticipate these to be a national way or a statewide way of dealing with these issues? Or do we foresee the city of Boise kind of following a separate pathway than our surrounding communities in the state?
Thank you
Or
for
if you
that,
have any way of
Council Member. I'd say that I know, at least for the CDC level, they've been slow to sort of kind of mandate to local governments how they respond, and I think the state government has been as well. I am aware, I'm not part of all of these conversations, but I am aware that the hospitals have some sort of staging plan about how they might react at different stages of this, including about on the backside of the curve. And so I think there are some plans in place there. But I can't speak to the central health district on that piece. But again, I would just echo kind of the importance of that collaboration, coordination across all of those three organizations.
And I'll jump in here. The mayors of the Treasure Valley and the county commissioners of the Treasure Valley are connecting twice a week to go through policy issues. It's incredibly important if we want to be the most effective in flattening that curve so that we don't hit capacity at hospitals and have more deaths than we would otherwise if we flattened it. And then at the same time that we do it and do it for long enough and at the right time are able to unwind and get people back to work. The most effective way to do that is to have a uniform way across a region or across a state, because of the travel back and forth between cities and our city. And so we are working, having conversations with the public health district as policymakers, thinking hard about what the next steps are for our communities to keep everyone safe. And it's not a national thing, it is a state thing. And the governor has said in many ways it's a local thing, but we recognize that for the best impact, we need to be working together. Great. All right. Well, I want to say thank you to Kyle, because we have asked our staff to repurpose themselves, become experts in new information. And while, as he said, Kyle's not a public health expert, there are so many resources nationally and locally set up to help cities, counties, regions, and states have the best strategy to protect our communities from the issue at hand, and then ultimately to continue to do research and figure out how we best get our community back to work. And Kyle has taken that charge through the Innovation and Performance Management team to learn it, take in as much information as possible, and then help us think about how we take data, make good decisions, all in the interest of protecting health and ultimately helping our economy recover. So
Madam Mayor?
Yeah.
Yes, I just want to echo everything that Mayor McLean has said. Kyle, thank you so much for taking this on, and it's really important information for a lot of folks moving forward. I did want to mention, and I don't know about my fellow council members or you, Madam Mayor, I still am getting contacted by the community, people very concerned about their ability to stay housed, especially those folks who are renting. I know one of our local nonprofits who's really taken the lead on addressing a lot of those concerns has been Jesse Tree. If you'll recall, at the end of last year, I proposed bringing forward $50,000 from our strategic contingency fund to support agencies like Jesse Tree to help folks navigate issues with landlords and increases in rent, never knowing that they would ever be in the situation that they are now. And I'm just wondering, do we have a connection with Jesse Tree, agencies like Jesse Tree, to just get a feel for what is happening in terms of folks reaching out to them? What is that looking like? I know we're at April 7th now, so folks who might have had issues paying the rent on April 1st it's now becoming more serious. And I'm wondering if we, just like we're getting information about folks who are becoming ill, deaths, that sort of thing, can we also make sure that we're connecting with those agencies who are addressing the needs of the housing insecure and what they're seeing in terms of evictions, if any of that is happening?
Yes, as you know, we called on the governor to take action. The courts have paused evictions. Many people are struggling right now due to unemployment and lost wages. Christine is in regular contact as the lead of all of our community support work with organizations that address housing. And so the prevention of homelessness, but of course also those organizations that are serving those who are unhoused. And taking in information, attempting to connect people with resources that are appropriate for their specific needs. And I believe maybe Christine can answer the date question if I'm not correct, but we've developed a resource connection website that was put in front of all of the nonprofits last night or this morning. And once they have signed off on it, it'll be going live as a resource for individuals. So anytime, right now, the best thing to do when we're hearing from constituents, like many people are, is to direct them to the organizations that we know exist to focus on their particular issue. However, soon there will also be a website that you can just send them to. And as soon as that's public, we'll let all of you know, and community engagement will be doing a public push so that people have access to the information.
Thank you.
Madam Mayor,
Go ahead.
I just wanted to echo your complimentary statement of Kyle. I think one of the biggest things about this is that there's been such a lack of clarity about what the next steps are, and we're just always trying to stay ahead of it and do the next right thing, to quote Frozen 2. And I think that having some concept of what the next steps will be and what kind of information we're going to need to make those decisions, and what kinds of information we're developing so that we can make good choices is really important. So I'm really thankful that we had that presentation from Kyle, and that we have a little bit more clarity and understanding about what next steps will look like and when those will happen, and that we still need to be flexible throughout.
Well, thank you all for your presentations, and we will see you next week.
Yeah. Good job,
And
everyone.
now we have the consent agenda to address.
Madam Mayor, I move that we approve the items on the consent agenda as presented, with the one change noted in the opening motion.
Second.
We have a motion and a second. Clerk, will you please call the roll?
Halliburton. Halliburton.
Oh, he's frozen. Look at his face.
Oh no.
Oh,
Oh, there's a thumbs up.
Sanchez.
Yes.
Thompson.
Yes.
Woodings.
Yes.
Bajent.
Yes.
Clegg.
Yes.
All in favor, motion carries.
Great. We have nothing on first or second. Wait, we do have a first.
We have a first, yeah.
Yes, we have a first. Sorry, I scrolled down too low. First reading.
Madam Mayor, I ask unanimous consent that all ordinances on first reading be read by number and title only and filed for the second reading calendar.
Second.
Without objection.
Oh, sorry.
ORD-13-20 and ordinance CAR 15-00029, Corey Barton Homes, Inc., enacting Title 11, Chapter 13, Section 3 of the Boise City Code to codify Syringa Valley Specific Plan District, SP03, provisions previously approved by Boise City Council, adopting the Syringa Valley Specific Plan approved as part of CAR 15-00029, amending Title 11, Chapter 5, Table 11-05.1 to add reference to Syringa Valley Specific Plan District, approving an ordinance summary and establishing an effective date. ORD-14-20, an ordinance repealing Boise City Code Title 6, Chapter 18, titled Use of Mobile Electronic Devices While Driving and providing an effective date.
That one. Okay. So Madam Mayor, now should I go ahead with the first, second, and third reading?
Yeah, sorry, I was distracted reading an ordinance.
I was too,
Yes,
yeah, sorry.
Please do. We have a first, second, and third reading tonight.
Thank you. Before I start, if I could, this is the emergency ordinance, and I just want to give a lot of kudos to our legal staff who just did phenomenal work to get us an ordinance in the first place so we could get this process moving, and has done awfully good work over the last couple of weeks, figuring out how to make this an ordinance that will stand the test of time. So thanks to them. And with that, I would move that all rules of the City Council interfering with the immediate consideration of Ordinance 12-20 be suspended, that the portions of Idaho Code 50902 requiring an ordinance to be read on 3 different days, twice by title and once in full, be dispensed with, and that the record show that this ordinance has been read in full, read the third time in full.
Second.
We have a motion and second. Clerk, will you please call the roll?
Halliburton,
Yes.
Sanchez,
Yes.
Thompson,
Yes.
Woodings,
Yes.
Bajent,
Yes.
Clegg.
Yes.
All in favor, motion carries. ORD-12-20, an ordinance repealing and replacing Title I, Chapter 15, Emergency Powers, and acting a new Chapter 15 to Title I, Boise City Code, entitled Emergency Powers, setting forth the authority, purpose, and intent, definitions, describing public health emergency orders, process for enacting public health emergency orders, providing for exclusions, providing for suspension of services, force majeure clause, penalty, providing for a waiver of the reading rules, and providing an effective date upon proclamation by the mayor posted in 5 public places of the city.
Madam Mayor, I move that ordinance 12-20 be approved.
Second.
We have a motion and second. Clerk, will you please call the roll?
Madam Mayor, could we comment just a bit? Again, I had my little comment. I think there might be others that may want to. I would just say, again, thanks to the legal department. These are unusual times, and they did great work, especially working with the City Council to answer some of the questions that some of us had, to make sure that we were addressing both the things that affect the City Council and some of the public comments that we got about the first ordinance. So thanks again to them.
Madam Mayor, I'd like to also commend the legal department on not only building us an ordinance that applies to this emergency, but that will help us to respond to future health emergencies. I think it's much easier to write something that, addresses what's directly in front of us than to imagine what we could need in the future also. And I think that this ordinance does that. I know that it was a ton of work, and I know that we have an amazing legal team and that they were really dedicated to it. So I just wanted to thank them for that work.
Madam Mayor, I think everybody's thankful for the legal team, and I certainly am too. It's just a truly massive undertaking, and I don't think that, it's not very public facing, and we don't see it. It's the back end city administration portion of governance. For people watching, the amount of work that our legal department did to create something that works, that is court proof, and that accurately and truthfully reflects the sort of the themes of democratic republic governance in a way that separates powers, that uses each of the bodies of our city government, the council, the mayor, the city staff, to their highest ability, and doing all that in a way that responds to a truly unprecedented, local reaction to a global pandemic. Truly high caliber work, and it's we are all saying we appreciate it so much because we've got to see it. Not everybody else has, but we have an amazing team of lawyers working for everyone in this community, and that's fantastic. The other thing I wanted to laud and compliment is the ordinance itself. What it does is permits it permits our mayor to respond quickly, decisively, and effectively in the context of situations that are emergencies, and that's what we need. It also permits, requires that the council participate in those decisions either before or after the fact. And so what the people get is the best of both worlds. They get decisive action and they get deliberative, contemplative, thoughtful input from the people they elected to represent them. And they get it in a way that balances responding to the emergency with being deliberate. And it's truly a fantastic piece of work. It is a model already throughout the state. I see this ordinance's language appearing in other places. Other people are looking at this and saying it's a brilliant piece of work by our legal team, and we should be very proud of it. I'm very proud of it, and I know everybody here has worked on it. It's a wonderful piece of work, and I'm so happy to be in a position where I get to support it like I do.
Well, I will wait. Does somebody? No. Okay. Oh, Council Member Sanchez, were you about to say something?
Sure, I'll go for it.
I'm muted, so I didn't want to cut you off.
I will just echo everything everybody says. I love lawyers. Lawyers speak a language that I then need Patrick, Councilmember Bajent, to translate into people talk for me. So while I'm thanking lawyers, I'd like to thank Councilmember Bajent.
Just before,
Madam Mayor.
Go ahead. I didn't see Councilman.
Jimmy here. Yeah. There's not that much I feel like I can add to what council leadership and council member Bajent said. I do want to recognize that, not only is it great work, but also everybody's experiencing trauma right now, even our legal department. And so they're having to deal with this crisis in their own personal lives and then doing work on top of it. So again, I'd like to commend them there. And then also just the mayor's office and Council President Clegg and Council Pro Tem Woodings for putting something together. I think it is important to note that our city leaders were really working together to create this one. And so I wanted to make sure that we thanked you all as well. So thank you.
Madam Mayor.
Yep.
Sorry, I just have a quick point. Again, very little I can add to the outstanding points that have been made. And I agree, this is outstanding work by the legal staff, all of you, and I'm proud to be supporting it. I think it's going to help now, not only now, but in the future. I had to make a stop at City Hall yesterday, and it was amazing because I literally saw no one, but yet all this work is going on behind the scenes. Everyone's at their house or somewhere, something like that. But it was literally a ghost town. But all this extraordinary work is going on, and that's just really remarkable, in my opinion, that it had to happen over 2-3 weeks. Everyone adjusts their lives in insane amounts, not just City Hall, but across the entire state. I mean, for the most part in city, I work at Idaho Power Companies, never ever spoken of having work at home days, and now literally almost the whole company is. It's neat to see all these companies come together and the city of Boise, and it reflects in this work that's being done and that we're going to be approving today. Thank you.
Well, I'll just say in closing, I really appreciate, I appreciate that each of you has called out your appreciation for our legal team. This is a time like no other, and none of us train for it, whether it be from a legal perspective or any of the work that we do. And the goals in this were to create an ordinance that would allow us and allow me, as Councilman Bajent said, to take quick, decisive action when necessary. Nobody ever wants to have to do that, but these times require it. And we need leaders to have the ability to do that and to be willing to do it to protect public health. And then also to respond to the important civil liberties that all of us believe deeply in the democratic process. So ensure that there was only a period of time that orders and steps that could be taken would be valid without further action by the mayor and ultimately the council. And then to engage each of you in the deliberative process, as you said. And ultimately for me, it was to ensure that we met all of those goals, but also so that in the next emergency, whatever that is, be it 50 years from now, hopefully more like 100 years from now, people aren't having to have the same conversations to create the ordinance to allow the mayor to take the action that she needs. And so we have something that can prepare future councils and future mayors to be able to respond to community needs quickly, while at the same time addressing day by day here with new information, the actions we need to take to protect our community. So thank you to the legal team for the work in doing this to get us to this point, because there are lots of drafts, and also to council for your deliberations around it and focus on helping to get it right. And with that, clerk, will you please call the roll?
Halliburton,
Yes.
Sanchez,
Yes.
Thompson,
Yes.
Woodings, Bajent,
Yes.
Clegg.
Yes.
All in favor, motion carries.
Thank you all. From the looks of the agenda with the deferrals, I think there is no other business to come before the council.
Madam Mayor,
Madam-
point of order.
Oh,
We haven't made any motions for the last deferrals in unfinished or new business.
oh, we haven't? Oh, I thought they said deferred automatically, so I didn't realize that we had to keep doing it. Okay.
Okay, Madam Mayor, can I make this all one motion? Okay, thank you. Madam Mayor, I move that SOS 20-2, CAR 1922, CUP 1964, and CUP 20-8 be deferred until further notice.
Second.
Motion a second. Clerk, will you please call the roll?
Halliburton,
Yes.
Sanchez,
Yes.
Thompson,
Yes.
Woodings,
Yes.
Bajent,
Yes.
Clegg.
Yes,
All in favor, motion carries.
Madam Mayor, I move we adjourn.
Second.
All in favor, motion a second, all in favor?
Aye.
Opposed? All right, we're adjourned.
Thank you, everyone.
Bye.
Take care, everybody.
Goodbye,
Night.
public.